Coming up after the break, muscle-building supplements have continued to gain popularity among men and women, but new studies show you need to be careful of the brands that you choose. Your time is 6:34 and it is 75 degrees outside. Welcome back to Good Day. Well, a study that revealed men who use certain muscle-building supplements may have an increased risk of developing testicular cancer. Dr. Parviz Kavusi, a reproductive urologist at St. David South, is here with us to discuss those findings. Doctor, thank you so much for joining us.
Thanks for having me.
Yeah, well, tell me a little bit about the study, and I want to know what type of muscle-building supplements are we talking about here?
Yeah, this is the first study of its kind, and it's really shed a lot of light on a big concern that we've had. So testicular cancer is the most common solid tumor that we see in men between the ages of around 18 and the mid-30s. And so it's a significant disease process that we are always screening for and looking for. And what we've seen is an increase in the incidence of it over time. So in 1975, when we looked at the incidence of it, it was about 3.7 per 100,000 men that were diagnosed with this cancer. And then over time, that's increased and increased to the point that it's about 5.9 out of 100,000 now. So that's a pretty significant rise over that time. So we've been trying to find out why that is. And there haven't been great studies telling us until recently. This new one that was performed has shown that guys that have used muscle-building supplements tend to have a higher risk of developing testicular cancer, and it showed as much as a 65% increased risk in those men. It's pretty significant.
That's very significant.
And these are supplements that we think of as being very benign, over-the-counter stuff. I mean, I'll tell you, when I grew up playing high school football in Austin, half the guys I played with were using things like creatine and supplements like this that are over-the-counter. You know, they're considered very common, benign things. Creatine and androstenedione are the two big ones that were found in the study that actually increased this risk. And it was a higher risk for guys if they started using it before the age of 25, if they use multiple different kinds of them, and if they use them for stretches longer than 3 years.
So you are seeing age playing a factor too, is when you start using these supplements, because I know that over time it's becoming more popular to use a lot of these muscle building supplements. It's actually the thing of, our generation. So what should these folks, these men, be looking out for, when they are choosing their muscle building supplements going forward?
Absolutely, and what you said is exactly right. We're seeing that it's becoming more and more common. As athletics have increased in popularity and everybody wants to be the star athlete, we're seeing a lot more use of this stuff. There's some things that concern us in the medical community. We, again, think of over-the-counter things as being very safe and benign, when actually those haven't gone through the same stringent clinical trials and testing as FDA-approved products like real medications that we write with prescriptions have. So they actually get our attention a little more in the medical community sometimes. What we would advise guys is good, healthy diet, solid exercise, high protein intake, and to really be cautious about some of these supplements. Besides this effect that we've seen, a lot of these supplements have androgens, what look like testosterone to the body, and if they take those by mouth, that can actually damage the liver, and that can actually damage reproductive function too. So we have to be really careful about some of these over-counter supplements, because they don't always tell you what all's in them exactly either.
Absolutely. There's been so many recent studies. This isn't the only one, but I also just read an article of a man who, has blamed some of his diet and the supplements that he's been taking to his liver cancer. So these are things that you guys should be aware of, and that's one thing that we wanted to point out today. So doctor, thank you so much. Where can they go to find out more?
They can go to our website at austinfertility.com, and if there's any questions, they can always call through there.
Okay, great. Thanks so much.
Thanks for having me.